Are PRP injections just expensive hype, or can they genuinely help knee arthritis? You may have heard celebrities, athletes, and even friends talking about PRP injections for knee pain. But what does the latest scientific evidence actually say? As an orthopedic knee specialist working across the UK and India, I'll explain what PRP really is, who benefits the most, who should avoid it, and whether it can actually delay knee replacement surgery. Knee osteoarthritis happens when the cartilage inside the knee gradually wears out. This can lead to pain, swelling, stiffness, difficulty climbing stairs, and reduced walking ability. Traditional treatments include weight loss, physiotherapy, painkillers, steroid injections, hyaluronic acid injections, and eventually knee replacement surgery. PRP injections are now becoming increasingly popular as a biological treatment option. PRP stands for platelet-rich plasma. A small amount of your blood is taken and spun in a centrifuge machine. This concentrates the platelets, which contain growth factors and anti-inflammatory proteins. The PRP is then injected into the knee joint. The idea is simple. Instead of just masking pain, PRP may help reduce inflammation and improve the joint environment. Now, let's talk about the evidence. Recent systematic reviews and meta-analyses published in 2025 analyzed multiple randomized controlled trials involving thousands of patients with knee osteoarthritis. The overall findings were that PRP can improve pain scores, knee function, walking ability, and quality of life, especially in patients with mild to moderate arthritis, younger biological age, and less deformity. Several studies showed benefits lasting between 6 and 12 months. Some newer evidence also suggests that higher platelet concentration may produce better outcomes. But here's the important part. PRP is not a miracle cure. It does not regrow a completely destroyed knee joint. And results can vary significantly because PRP preparation methods differ. Platelet concentration differs. Some preparations contain white blood cells while others do not. And injection protocols are inconsistent between clinics. Some recent placebo-controlled studies found that PRP provides modest improvements mainly in the short to medium term, while long-term superiority remains debated. So the science is encouraging, but not perfect. In my clinical experience, the best PRP candidates are patients with early or moderate arthritis, active individuals wanting to delay surgery, younger patients, and patients with persistent symptoms despite physiotherapy and lifestyle modification. PRP tends to work less predictably in severe bone-on-bone arthritis, major deformity, severe stiffness, or inflammatory arthritis. So how does PRP compare with other injections? Steroid injections can provide good short-term pain relief and may help during flare-ups, but the effects are often temporary. Hyaluronic acid injections aim to improve lubrication within the knee joint, although international evidence remains mixed. PRP injections are more biologically active and in many recent studies appear to provide longer-lasting symptom improvement than hyaluronic acid injections. However, they are usually more expensive, and no injection permanently cures arthritis. The good news is that PRP is generally considered safe because it uses your own blood. Possible side effects include temporary pain flare, swelling, stiffness, bruising, and very rarely, infection. Ultrasound-guided injections may improve accuracy. So what's my clinical opinion as a knee specialist working in both the UK and India? PRP is a reasonable option for selected patients with mild to moderate knee osteoarthritis. The latest evidence suggests meaningful pain improvement, improved function, and possibly delayed progression in some patients, but results are variable. Not all PRP preparations are equal, and it should always be part of a broader treatment strategy including weight optimization, muscle strengthening, activity modification, and long-term lifestyle management. If your arthritis is already severe and bone-on-bone, knee replacement may still be the better long-term solution. If you found this video useful, subscribe to the channel for more evidence-based knee care content. Comment below if you've tried PRP injections and whether they helped. And let me know which topic you'd like me to cover next: stem cells, arthrosomid, gel injections, or robotic knee replacement.